So you were a consultant psychiatrist between when? What's the
64 until I joined the Mental Welfare Commission, which was 84 really.
And what can you comment on the sort of trends of psychiatry in that time? I mean, did it change much?
Yeah, it changed in terms of medication available. There were always new antidepressants coming in, but I can't say that they changed the face of psychiatry in a dramatic way. They made a difference. The other bit, though, was perhaps is more important, that we did, over that time, we did try to identify the different needs of different groups of patients, so that we were all the time, we were in the hospital setting, we were trying to set up appropriate units for different, and my role in that, actually, when I think about it, was to do with the elderly, because latterly I'd call myself a psychogeriatrician, and it was as simple as this, that go back to the Roslyn Lee days, which is a long, long time ago, I know, and the ageing population in the hospital, they sat in a ward all day long, and quite a proportion of them sat in a commode all day long, and quite a lot of them would have their bandages just to make sure they stayed in their seat, their commode seat all day long. I mean, it was pretty primitive and pretty nasty, and yet a kindly, the nurses were lovely to them and looked after them well, but that was the sort of atmosphere. And then, when I was a consultant in general psychiatry, in the Andrew Duncan Clinic, we were finding that the advancing dementia problem, the ageing population, all the stuff that people talk about now, was such that we'd get an old demented patient into our acute ward, and it would cause havoc. And it became bad for the patient, for the old folk, and bad for the younger people. And so I did get involved very much then in reviewing our long stay wards. That's right. We managed to change these hundreds of beds, I suppose it would be at that time, 4 or 5 wards with 30, 40 patients and 30 patients. Anyway, leaving aside numbers, we managed to divide them up so that we had the truly long-stay psychotic patient with their particular needs, and another ward for functionally disturbed old people with depressive illness and paranoid states and things, and the dementias. And by dividing them up, I really think it made a big impact on the care that they got and the throughput, because the second group there should be curable and treatable and outable. There should be no reason why they shouldn't go out of hospital again. Or a day hospital. We set up day hospitals for them. Whereas the really severe demented person required a different sort of care. And they built that huge, what's I involved in the Jardine Clinic, especially for dementia.
So you would think that this kind of oversee and review of the management and groups and so on, that has had more influence than the drug therapy and the pharmacology, would you think?
I think it deserves to be
at least equal.
It deserves to be considered as such, yes, yes. Because each time, if you think of it, each time you have a ward, a group of patients where there are one or two inappropriately placed patients, they create havoc. Whichever group they're in, they create havoc for the others. They take up a huge amount of nursing time at the expense of the others, and don't help very much. So I think that has been an important change. And one of my jobs in the university side of life was to do the lecturing on psychogeriatrics, on the ageing, I forget, psychiatric illness in the elderly, something like that. And this was in the 70s, yeah. And I gave my little lecture, a series of lectures, and the big graph, of course, the most essential graph that you put up, was this thing showing how many old people there would be in maybe 2006. You know, that the huge increase in population. And a sad thing to me is that was never, at a political level, I mean, in terms of the public at large and the politicians, they never really paid attention to that. I don't mean to me, but to that kind of graph, did they? And so you still heard people, and I think everyone accepts it now, but say 5 years ago, you would still hear politicians announcing this as if it was a brand new discovery. And yet of all statistics, that was the most obvious one, because it was people who were born, it was birth rates that they were talking about. And the fact that this birth rate meant that in 80 years on, there'd be a heck of a lot of old people with dementia and everything else.